Yes, top of the moment to you. Wonderful Saturday night, be. And like we take talk few minutes ago, say waiting. Say Health Matta with Dr. Bat go so enter. And as we don't reach that is he don't enter. Oh, go they ask Dr. Bat. Anything where they do our mind yaga yaga. As far as this pandemic, where they call COVID-19, tabi make it call coronavirus, they concern. So on top of that, I welcome Dr. Bartholomew Ufegbonam, CEO, Grace Valley Medical Center, to the show. You're welcome, sir.
Thank you very much, sir.
Good morning, sir.
Yeah, I'm pleased to be back. Good morning, viewers at home and around the world. Today we'll be looking at a topic we started some few months ago, coronavirus pandemic. What is new? What new information do we have for us this morning? Okay? We'll be looking at the things that have happened in the last couple of weeks with respect to our environment, talking about the African environment with respect to the world as a global village. Where are we today? What do we need to know? Now, it is no longer news that Nigeria is getting ready to institute what the Lagos State government described as home management or home-based care for people who are infected with coronavirus contagion. Now, this became necessary because it dawned on the policymakers that the numbers were increasing exponentially, talking about the ongoing active community transmission. As a matter of fact, in Lagos alone, the active cases are over 4,000 as we speak. And it is very obvious that government may not be able to accommodate all of these individuals. So it becomes imperative that we need to educate our masses on the things that we are not doing right, on the things that need to change, so that we'll be able to stop or break the ongoing community transmission, so that we don't get to a level that will be beyond what we can manage. So we need to do all that are necessary to flatten the curve. And this morning I'll be starting with giving us overview of what WHO has advised that we should do. WHO Director General just yesterday gave a new guideline on how face masks should be used. It's no longer news that before now, WHO did not openly support the public use of face masks. But based on the available evidence, based on the studies that were carried out and the researches that were recently done, they have now come out to issue their own guidelines. And I want to read what the Director General said yesterday, verbatim. Okay? Today, WHO is publishing updated guidance on the use of masks for control of COVID-19. The guidance is based on evolving evidence and provides updated advice on who should wear a mask, when it should be worn, and what it should be made of. Very important. WHO has developed this guidance through a careful review of all available evidence and extensive consultation with international experts and civil society groups. I wish to be very clear that the guidance we are publishing today is an update of what we have been saying for months, that masks should only ever be used as part of a comprehensive strategy in the fight against COVID-19. Masks on their own will not protect you from COVID-19. Here is what has not changed. WHO continues to recommend that people who are sick with symptoms of COVID-19 should remain at home and should consult their healthcare provider. People confirmed to have COVID-19 should be isolated and cared for in a health facility, and their contacts should be quarantined. If it is absolutely necessary for a sick person or a contact to leave the house, they should wear a medical mask. WHO continues to advise that people caring for an infected person at home should wear a medical mask while they are in the same room as the sick person. And WHO continues to advise that healthcare workers use medical masks and other protective equipment when dealing with suspected or confirmed COVID-19 patients. here is what is new. In areas with widespread transmission, WHO advises medical mask for all people working in clinical areas of a health facility, not only workers dealing with patients with COVID-19. That means, for example, that when a doctor is doing a ward round on the cardiology or palliative care units where there are no confirmed COVID-19 patients, they should still wear a medical mask. Second, in areas with community transmission, we advise that people aged 60 years or over or those with underlying conditions should wear a medical mask in situations where physical distancing is not possible. Our guidance also explains how to use a mask safely. People can potentially infect themselves if they use contaminated hands to adjust a mask or to repeatedly take it off and put it on without cleaning hands in between. Masks also can create a false sense of security, leading people to neglect measures such as hand hygiene and physical distancing. I cannot say this clearly enough. Mask alone will not protect you from COVID-19. In the light of the evidence, WHO advises that government should encourage the general public to wear masks where there is widespread transmission and physical distancing is difficult, such as on public transport, in shops, or in other confined or crowded environments. Our updated guidance contains new information on the composition of fabric masks based on academic research requested by WHO. Based on this new research, WHO advises that fabric masks should consist of at least 3 layers of different materials. Details of which materials we recommend for each layer are in the guidelines. We also provide on how to watch and maintain a fabric mask. Along the, as we go on into the presentation, we will be able to show you a video from WHO as well, demonstrating how cloth masks should be made. But the major essentials of cloth masks is that it must contain 3 layers, and those layers are specified in terms of what function they are expected to do. Now, I also want to point out that we've seen that the cases we have in Nigeria the number of cases we have in Nigeria has continued to increase over the past weeks. And some people are beginning to wonder, what is going on? Is it that all those measures that are being put in place are not giving us the desired results? The truth of the matter is that non-compliance can be taken as one of the reasons why we are still not getting where we should be in terms of controlling the spread of this highly contagious infection. You discover that on the street, not so many have actually made up their mind to do the right thing. You see a number of people who are putting their face masks just below their chin. A number of them will be having it at their forehead instead of covering the mouth and the nose. You'll be wondering, why is it that we have been talking about mask? It is essential, but it must not be taken in isolation. You must also do that alongside other infection prevention control protocol, IPC protocols, which of course include hand hygiene, social distancing, and of course, we do know that the major routes of transmission at the moment for COVID-19 is through respiratory droplets. We have said that before. If you have somebody who sneezes or talks around you that is not putting on a face mask, the person puts you at risk. If you're in a gathering, if you're in a discussion with someone in close proximity and the person is not putting on a face mask, the person puts your life at risk. Why is it so? It is so because majorly now, the new discoveries that we have on our hands have shown that asymptomatic carriers can equally pass across this disease to people around them. So we have symptomatic carriers. It's easier for us to monitor those ones. Temperature checks can actually pick out who has temperature or who does not have. We actually can pick out people who are coughing. But when it comes to asymptomatic carriers, it becomes difficult. So you can actually not know who has it and who does not have it. And that is why it's essential that we don't take any of these things as a joke. If you're putting on a mask and you discover that such a mask cannot allow you to breathe, in time past in this program, we have mentioned some of the qualities that a good mask should have. Adequate breathability, ability to breathe in and out freely. You should look for a mask that can actually allow you, that can actually fit your own purpose. If it does not, please do not use it. You must use something that can actually protect you. Thank you very much.
Okay, thank you very much for the lovely delivery. That, let me call it the opening literature from our own Dr. Bat.
Thank you very much.
And going back in English language, when they give you comprehension like this, they will say, give it a title. I think I'll give this one mask only. Or mask alone. Like he rightly read that. Maybe we should make it mask alone. So can mask alone protect you from COVID-19? Can mask alone keep you safe? Can mask alone guarantee good health? All these and many more are the questions we will ask Dr. Bat. Most definitely when we come back from this shikini break, we will want to go nowhere. Once we come back, we'll go open phone lines. All of us going to deliberate together. Health Matter will be right back. Stay tuned.
Health matter na serious matter o. That na why we dey always get Dr. Bat Ufegbunam every Saturday to come teach us and enlighten us on top with health matter. You fit also advertise your product and services on top with show where dey help people. Terms and conditions apply sha o.
Hello. Today I'd like to talk to you about how to wear a non-medical mask, also known as fabric mask. Fabric masks can be used by the general public in areas where there are many people infected with COVID-19 in the community and physical distancing of at least 1 meter cannot be achieved. There are a wide variety of fabric masks that can be handmade or purchased in a store. They act as a barrier so that you can protect those around you. They should ideally be made of 3 layers of fabric. The outer layer should be a water-resistant fabric. The inner layer should be water-absorbent, and the mid-layer acts as a filter. First, clean your hands with alcohol-based hand rub or soap and water. Pick up your clean mask and inspect it. If it is damaged or dirty, do not wear it. Place the mask on your face, covering your nose, mouth, and chin, making sure there are no gaps between your face and the mask. Do not touch the mask while wearing it to avoid contamination. If you accidentally do, clean your hands. Before touching the mask, clean your hands with alcohol-based hand rub or soap and water. As you remove the mask, lean forward slightly and remove the loops from behind the ears without touching the front of the mask. And don't forget, wash your hands after taking off the mask. Make sure that you have your own mask and do not share it with anyone. If your fabric mask is not soiled or wet and you need to reuse it, you can store it in a clean plastic resealable bag such as this one. However, if it is dirty, do not use it. Wash it with soap and water, preferably at high temperatures after each day of use. Remember, a mask alone cannot protect you from COVID-19. It must be combined with protective measures, including maintaining at least 1 meter distance from others and washing your hands frequently. Stay safe and help prevent the spread of COVID-19. Medical masks should be worn by health workers and those caring for someone with COVID-19 symptoms, persons aged 60 and over, and anyone with pre-existing medical conditions, as they are at greater risk of developing serious illness, and people who have symptoms suggestive of COVID-19. Before touching the mask, clean your hands with alcohol-based hand rub or soap and water. Inspect the mask for tears or holes. Do not use a mask that has previously been worn or is damaged. Verify which side is the top. This is usually where the metal strip is. Identify the inside of the mask, which is usually the white side. Place the mask on your face, covering your nose, mouth, and chin, making sure there are no gaps between your face and the mask. Pinch the metal strip so that it molds to the shape of your nose. Remember, do not touch the front of the mask while using it to avoid contamination. If you accidentally touch it, clean your hands. Now, how do you take off a medical mask? Before touching the mask, once again, ensure that you clean your hands with alcohol-based hand rub or soap and water. Remove the straps from behind the head or ears without touching the front of the mask. As you remove the mask, lean forward and pull the mask away from your face. Medical masks are for single use only. Discard the mask immediately, preferably into a closed bin. Clean your hands after touching the mask. Always be aware of the condition of the mask. Replace it if it gets soiled or damp. A mask alone cannot protect you from COVID-19. It must be combined with other measures, including maintaining at least 1 meter distance from each other, washing your hands frequently, and avoid touching your eyes, mouth, and nose while wearing a mask. Stay safe and help prevent the spread of COVID-19.
Yes, it's pertinent. We appreciate the World Health Organization. On top of that material where you just watch, we should be saying a big thank you to them. And vis-a-vis, like I TikTok and say, maybe we make the title of today's comprehension passage, Mask Alone. And that woman will be educator, so she said, don't talk at the end of that clip, say, mask alone, if we keep you safe. So we'll go open the phone lines now. As we open the phone lines, questions going to come from we where they here, plus you where they there. We'll go to Sambla. Why is everything? Give Dr. Bato, because we know saying don't ready. Giddy ba bang ba. Dr. Bat,
Thank you,
the phone lines are open, so calls going to come in, but make we start them here because they say charity
begins at home.
Yeah, but it begins from also this time. Yeah, so let's start with the issue of tobacco smoking. Tobacco smoking, are they at risk of COVID-19? And if they are at risk, at what degree?
Thank you very much for that very important question. I must point out I'm getting it for the first time. That said, tobacco smoking has gone beyond cigarette smoking. Okay, so we now have the one they call, is it water pipe or pipe water? Shisha. I'm talking about shisha.
Okay.
Okay, so we have shisha, and then we have some other ones, not just cigarette smoking. Essentially, it does a lot of damage, not just because of COVID-19. It does a lot of damage to the lungs. It reduces and impairs lung function. I was actually reading a study recently where I saw that if one quit smoking, within a space of 20 minutes, and one decides to quit smoking, the first 20 minutes, the person's heart rate will start dropping. The person's blood pressure will start coming down. Meaning that these agents, that's tobacco, can actually increase an individual's heart rate, an individual's blood pressure as well. Now, if you're able to stop smoking for some certain number of days, it will also remove the carbon dioxide toxicity that may have gone into your bloodstream. It will start clearing. So when you smoke, you intoxicate your blood. You reduce and damage your lung functions. And of course, we do know that the lungs actually are the major organ that COVID-19 usually affects. Okay, so for smokers, you need to know this. Once you're smoking, so according to WHO, they don't have any peer review for any study concerning smoking with respect to COVID-19. But what we do now at the moment is that because in the act of smoking itself will involve your hand getting to your mouth. So you could be smoking with a contaminated hand, which of course when you bring it close to your mouth, you can infect yourself. Okay? Ditto for other ones that one can use the mouth or to suck through.
The pipe.
And then it does a lot of damage to one's lungs. Not just for COVID-19, but for a number of other respiratory diseases as well. Thank you very much.
Well answered, sir. I would quickly engage you again. The issue of home-based care, you read them for the material where you carry come, and I also see the person will enlighten us on face mask usage too, and say if you want to give your person care at home. But Dr. Bat, considering our own environment, when we talk, we even take our inside paper today, say government, Lagos State government, they advocate or they look into this home-based care. Sir, the kind of environment we find ourselves, face me, I face you, where one person, 8 people, they live inside one room, and one person, peradventure, gets COVID-19. How do we face reality in this, our own economy? How are we not going to shy away from the pragmatic truth that with the many inside some houses?
Thank you very much. Thank you very much. That's a very important question. And I want to believe that should be the reason why Lagos State government is taking their time, okay, because they haven't yet brought out the guidelines that we are going to follow for home care management for people who are infected with COVID-19. But I must also point out that it looks as if it's taking a lot of time. Why am I saying this? Because if you look at the active cases that we have been getting in the last couple of days, you discover that people who are infected, active cases in Lagos alone is over 4,000. And these people have been living in their houses. They ought to have known before now this is how to go about it. And I want to believe those people must have been communicated to. Now, talking about home care, it's going to throw up a lot of challenges, no doubt. I also must appreciate the Lagos State government for the good work they are doing. I listened to the press conference that the Honorable...
Sorry, sir, I think that's a statistic representation.
Yes, so I listened to the governor's press conference about 2 days ago. There are a lot of plans they have for Lagosians. There are a lot of efforts that are going in, okay? But the truth of the matter is that the pandemic appears to be faster than our response, and is unfortunate. So people who are infected, if you're in the house, there are a number of things that you need to know at the moment. Now, if you're a loved one and you're caring for somebody who is infected in the house, you now know that you cannot afford to wear cloth masks to go and look after such a person. You need to get the medical mask that has been shown to us. Once you're in close proximity or entering a room that has an infected individual, you can't wear the cloth face mask.
You can't wear Ankara. Let's
you can't wear the fabric. Yes, you can't wear the fabric that some of us are using. A good number of them are actually single layer. And I also want to say that I'm happy that WHO has come out to give us an idea of what a cloth mask should look like. It must have 3 layers.
3 layers.
At least. Okay, but again, what some of these people are avoiding, the more the layers, the more difficult it is for people to breathe in. And you discover that they will start hanging it on their chin. Instead of becoming face mask, it now becomes chin mask. And
or
of course,
neck mask.
Or neck or forehead
or
mask.
Cap.
Okay, but by and large, what we need to know is that the game has changed. And it changed not because we haven't given best of efforts, not because our government haven't lived up to expectation, but because the pandemic appears to be moving faster than everybody. The whole world is rattled, not just Nigeria. US is rattled. At the moment, their figure is about hitting is over 1.9 million. Okay, even developed countries of the world, nobody can say that it has been easy for the person to handle. So now that we're embarking...
Sorry, sir, while you are saying this, I've not heard anything about China. I've not heard anything about... Nobody is talking about... All of a sudden, nobody is talking about China again.
Now,
Nobody's talking about Wuhan again. What's happening?
The reason why people are no longer talking about China at the moment, I'm looking at the list from the highest infected. China can't even be found until after about 15th. So you discover that you have US first, 1.9 million and above, Brazil, 646,000, Russia, Spain, UK, India, and of course, Italy. China is not within the first 15 as we speak.
China
now,
is not within
yes,
the first 15.
Within
And
the
it
first
came-
16,
Wow.
yes, as we speak. Now, what have they been able to do? They've been able to put these measures, these infection prevention and control measures in place. A lot of Asian countries actually started wearing masks a long time ago. So it's becoming part of their culture. So we need to imbibe such culture to actually protect ourselves if we must actually put a stop or break this ongoing transmission of home care. I also read that the Lagos State government are making plans to give a bag to people who will be catered for at home that will contain thermometer, that will contain probably a pulse oximeter, that someone can actually use to monitor
Like
his or
a
her.
kit.
Yes, a kit. Those infected individuals that are at home can use to monitor their vital signs and then communicate to the health caregivers, to professionals via telemedicine. In 2 weeks' time, we'll start seeing all of that. But what can we be doing in the interim? Because as we speak, of a truth, there are infected people who are still living in their houses. There are infected people who are finding it difficult to wear any form of mask.
Okay,
These
sorry.
people will be...
Sorry, sir. Let's take Victor. Sorry to cut you, sir. Victor, good morning.
Yeah, good morning, doctor.
Yeah,
Good
Dr.
morning, my
Bat is
brother.
here.
Yeah, please, I want to confirm something.
Go ahead, sir.
If somebody go out and without handshake with anybody, if any need to come and wash hands again?
Thank you very much. It's not until one does have a handshake with anybody that he or she needs to wash hands. For instance, I'll cite a situation. As we are seated here, if any of us here sneezes, as my chief is not putting the face mask today, if he sneezes, all of this will hang in the atmosphere for a while. It could drop on hard surfaces. It could drop even on my own hands. Now, if I take off the mask without washing my hand and probably end up touching my eyes or my nose or my mouth, if he's an asymptomatic carrier, of course I can get infected. So when you touch hard surfaces, usually I want you to look at it this way. Not just when someone talks to you. Somebody could sneeze and cough in an environment and leaves the place. And then you enter and touch the particular surface, hard surface, that those released aerosolized droplets have fallen on. Now, if you touch that mistakenly, even without knowing, and end up touching your face, of course you get infected. That also reminds me, a good number of times, even with our currency notes, we discover that some of our market women, not just market women, I think a number of individuals too, when they want to count currencies, they spit on their hands and then touch the currencies this way. They touch their tongue, and of course, such practices need to stop. We are learning a new normal. Everybody have to step up the game.
Don't know.
Yes, do you understand? So there are a lot of practices that we do in our part of world that we need to stop. Otherwise, we can actually not be able to break the ongoing community transmission that we are seeing.
Okay, Dr. Bat, thank you very much for that answer. I think another thing we should be asking ourselves is over the papers, like I think last week, the issue of yes to chloroquine, no to chloroquine, and at the point I'm beginning to see it, is it Trump versus World Health Organization, or is it a power tussle? Is it about our health now, or somebody's job? Because I know Trump has once come out and said yes to this chloroquine to Americans. Now we got no, but now the thing is back, and it is like they've resumed it as a trial stuff. Why, sir? Why? What is happening on chloroquine?
Yeah, I was actually expecting that question. In fairness to all the world leaders, WHO, Director General, and everybody, they've all have done wonderfully well. They've given their best. This is a new infection, a new virus. Nobody has any prior knowledge about this. So everybody is learning at the same time. Okay? So you must give room for errors of judgment where such exist. Now, talking about I do know that the ongoing solidarity trial, of course, the trial is for 4 drugs, 4 therapeutics. We have said that a number of times. Chloroquine and hydroxychloroquine is 1, remdesivir is 2, and then 2 other drugs, HIV drugs and some other combination. Now, what happened was that WHO, when there were issues of health concerns emanating from some areas of the world, okay, so those data were the things that WHO looked at. And as a precautionary measure, they decided to stop just 1 arm out of 4. So there were other 3 that the protocol, the trial were going on at about that time. But that of chloroquine, hydroxychloroquine, was stopped, was halted, was paused for a reason, so that WHO can do some critical, take a critical look at it. So what happened is that they assigned their safety monitoring committee to look at those data that emanated from some countries of the world, the US and some other places, and ascertain the authenticity or otherwise of those data. So when they discovered that there was that those data were flawed, they have to change their position. Now, those were the things that actually brought about the suspension, because it was speculated that hydroxychloroquine can actually cause cardiac arrhythmia. So for people who have pre-existing heart conditions like hypertension, it could actually cause death if it is used in such persons. But all of that have been discovered to be false. So that is why it was a precautionary measure they took. But however, the trial has been commenced. Permit me to also say that a number of countries did actually not suspend the trials at that time. Nigeria, for example, continued with the trial. And I must give kudos to our Nigerian team.
Of course. I think that should be Dr. Osagi and others, and even the Commissioner for Health, Lagos State. Okay, moving forward, sir, the issue of fabric. We've talked about fabric. You said the fabric should actually have 3 layers. Are we looking at the usual ones we buy 200 naira from our tailors now? Or we should kukuma discard that? Should we say that cannot pass for COVID-19 again? Let's know the one we are facing. Or if I know that my own is just to go out, I'm not meeting with somebody who is carrying this stuff, okay, I can wear it. I want you to talk about fabric or face mask now, sir.
Now, talking about fabric face mask, I think this guideline should have been out much earlier than now, of a truth, because you discover that people were just making cloth masks, whatever you can cut. I've seen all sorts. Just convert it. A lot of people will wear it, and you discover that there will be a gaping space between their nose and their face and the mask. So some of those masks may actually not do the work that was originally intended. Number one, some of them are so thin that the droplets may be able to escape and pass through them. So now that we know what WHO is saying that we should do, I think it behoves on those people who are involved in the making of our cloth masks or fabric masks to go back again and see how they can improve upon what they have started. But I must also say at this point that it is better to wear one than not wear anything at all, whether it is 1 layer, 2 layer, or otherwise.
Okay, Dr. Bat, moving forward, another term, because as COVID-19 they go on, now so new term they come out. So the one where I want to make you shed light before we go now, where I want to make you help us explain where we're at this show of asymptomatic and asymptomatic and symptomatic. I know that for now these words are still interchangeably used, and we've not gotten a lucid meaning of them. So help us.
Thank you very much. Now, what symptoms? When you talk about symptoms, we have Roland from Delta.
Sir. Good morning, Roland.
Yeah, good morning, Doc.
How are you
doing? Good morning, my brother.
Fine. I want to ask you something about the difference between malaria and COVID-19.
Okay, thank you very much. Noted, Roland.
Thank you very much. Now, the difference between malaria and COVID-19, in terms of causative organism or agent, okay, malaria is caused by a parasite, while COVID-19 is caused by a virus, okay? Now, I won't want to go into details of the number of but I know usually people ask this question because of the relations between the symptoms for those two medical conditions. The presentation you have in malaria is somehow the same thing, about the same thing with what you have in COVID-19 disease as well. And also, a number of people have actually tried to draw some similarities between the two. Chloroquine can treat malaria. We are beginning to hear that chloroquine cannot equally treat. Shouldn't they be the same disease entity? No, they are different. Of course, we know that one can only get infected with malaria if you get bitten by mosquitoes or probably get transfused with blood of an infected individual that contains the parasite. Okay, but for COVID-19 is a different ball game. The route of transmission, we have said that countless number of times, via respiratory droplets that can escape from one's mouth when such a person is speaking, discussing, or sneezes or coughs in an enclosed environment. Now, back to your question, sir.
Yes, the issue of symptomatic and asymptomatic.
Thank you very much.
carrier.
Now, when we talk about symptomatic carriers, we are referring to a group of people that are showing symptoms. Those infected individuals that can cough, that can sneeze, they are the ones that are showing symptoms. Or that may have fever, or that may have dry cough. Those ones are showing symptoms. They are grouped as symptomatic carriers. Now, the other individuals who may not be manifesting any sign, but before asymptomatic, I also want to talk about pre-symptomatic carriers. Pre-symptomatic carriers. Now, this group of individuals are people who may not be presenting with symptoms at a particular time, okay? But over a period of few days, don't forget, the incubation period of COVID-19 is said to be between 1 to 14 days. Okay, but the mean incubation period is actually 5 to 6 days. Okay. So 2 to 3, 4 days, such a person may not be presenting with any symptoms, but afterwards, maybe by the day 8, 10, the person will start showing symptoms. I saw something on the news before I came on air. Somebody who tested negative and boarded a flight in a particular city, landed in another city and tested positive.
How?
So he probably was pre-symptomatic carrier at the time the flight took off, and then landed. By the time he was landed, by the time he landed in another city, with passage of time, he has become a symptomatic carrier. Now, asymptomatic carrier, the third one now, are people who, regardless of their of the fact that they are infected, they still do not show any sign or symptoms. And such group of people may end up having mild disease, in which case they may not need to be hospitalized to survive from the disease. And those set of people...
They may not need to be hospitalized.
They may not need to be admitted in the hospitals to survive the disease.
Can they also spread?
Of course, they are contagious. They remain contagious. Despite the fact that they are asymptomatic, they still remain contagious. That is why WHO has come to back the use of face masks. So if
I get you right, they are asymptomatic means they have it, but they are not coming down with it.
They have it, but they are not showing symptoms. They are not coughing. They are infected, but they are not coughing. They are not sneezing. They don't have temperature. That is what asymptomatic means. But they are infected already.
The word I use, is it also allowed that they are not coming down with the disease?
Not coming down with the disease, yes, can equally be linked. They are linked because if you're not coughing, if you feel normal, that accounts for the reason why you discovered that some of the videos that we saw on social media recently that showed some people who are kept on in isolation centers playing games and doing all sorts of things. Now, those people were able to do those things because they were not really presenting with symptoms. Somebody who probably is vomiting and stooling will be so weak and tired that he can't even stand up to play any game.
Of course.
Okay, so that is right.
Maybe in a line. Meanwhile...
Okay, so, but what I want to say is that 80% of the people that will get infected may not show any symptoms or may show only little or no symptoms at all. It's only 20% that will present with symptoms. So those temperature checks we are doing and all other checks that we are doing are just for 20%, less than 20% of people.
Oh, okay, thank you very much, Dr. Bat. That's that one we will get from you. Most definitely it will last us till Saturday next week.
Thank you very much.
Therefore, so make we stay safe till we meet again Saturday next week. Bye-bye.
See you next week.